right, guys. For this episode, I had the pleasure of speaking to Kristin Yates, and she is a wife, a mom, an OBGYN, and she has a passion to help young physicians overcome imposter syndrome. And we have this great conversation around what were the things that she dealt with going through the process of medical school and residency. And imposter syndrome is definitely something to think about and consider, because often, as you will hear in this conversation, we can go through the process of training or going through something and just believing that we're not good enough, believing that it is impossible that we're actually here. And those thoughts can really negatively impact us and make us feel like we're an imposter instead of actually owning where we're at. So I'm really excited for you to listen to this episode. So please enjoy this episode with Dr. Kristin Yates, and you can find her on Instagram. It's Kristin Yates DO, and you can feel free to message her or contact her if you were inspired by the episode. So without further ado, please enjoy this conversation with Dr. Kristin Yates.
Thank you so much, and thank you for having me. I am an OBGYN physician. I'm in private practice in New Hampshire, and I stumbled across your podcast when I was kind of searching for a way to not hate my job anymore. And I struggled with burnout soon after I graduated from residency, actually, when I became an attending back in 2016. And what I realized ultimately through the whole journey was that it stemmed a lot from these feelings of imposter syndrome. And the more I talked about it to my colleagues and co-residents that I had graduated with, I realized that I wasn't alone in my feelings that I didn't really belong where I was. And then ultimately became a passion of mine to overcome it, which I've successfully done, but then also help other residents and young physicians to realize that they're not alone in how they feel, and also that there might be a way that they can stop feeling like that.
So let's take a step back for a second. OBGYN and medicine, where did that passion or what kind of fueled you to pursue a field as a physician? Because, as we know, it's not an easy road. So what got you into that mindset of taking on such a big commitment?
Yeah, it was definitely a winding road for me. When I was in high school, I thought for sure I was going to be a lawyer and then a judge. And then in my first year of college, I realized that I hated politics and law of all sorts. So I had to take a step back there, and then found my way through like the biomedical sciences. Really loved psychology as a freshman in college, and kind of thought that I would do a psychology major. And then I came to a crossroads where I thought I would want to pursue an advanced degree. And I was trying to figure out, do I want to go to medical school or get a PhD? And the thought of working with rats really wasn't appealing to me. So That's actually how I ended up in medical school with a psych major, essentially really loving like the brain and all that stuff. And then really kind of just fell into OBGYN. I really love women's health and preventative medicine. And I like procedures. So it ended up being just the perfect mix of all the things for me.
Yeah, that's great. And, I think it's so interesting because for me, I had no desire at all to go into psychiatry.
Yeah.
I thought I was going to go into either family or peds or emergency because I'm a little ADD and I like to do lots of stuff. So and then I went on a psych, and it was just like, I think this is it. Like it just fit. Yeah. And it sounds to me like that was maybe what happened to you on your rotation.
Yes, exactly like that. Like it just felt like home for me when I was a third year, and I was like, it just felt like the best fit. I didn't really hate anything that I did. It was just that felt like the most like me.
Yeah. So, obviously we're going to kind of talk about imposter syndrome and dig into what the signs are and those types of things. But do you feel like that already started to happen earlier on in medical school? Do you feel like, there was something happening that maybe you weren't even noticing before the rotations? Like when did that start for you?
Yeah. Looking back now that I know what it is, it was definitely, I probably had some degree of it in college, but it was amplified in medical school. I remember the day that I got my phone call that I had gotten into medical school, my first inclination was that they called the wrong person, which is like a telltale sign of imposter syndrome. So I think that every new step in medicine where you're just, like they say, it's drinking from a fire hydrant. You're constantly bombarded with new information, and you're around some really intelligent people. And I really thought that because I had to work hard, it meant that I didn't belong there. So I think it was probably soon after I got into medical school that I was feeling that way. I just didn't know what it was.
Yeah. And, it's funny you say that, like you assume that needing to work hard that you didn't fit. I mean, I'm the type of person, maybe you don't know this background about me, but I'm an athlete. Like I like competed in gymnastics my whole life. And so I'm very much constantly trying to work hard. And I really took it on as an athlete, but in medical school, I felt so stupid because I just felt like I needed to repeat things more than everyone else. And I had one close friend of mine in school. He literally, and I'm not even kidding you, he was able to tell us, he could literally say, oh, slide 40 of lecture 3, on that 4th bullet point, it said this. And he photographic memory, whatever. And so when you hang out with someone like that, it's like, oh, I'm so dumb.
Yeah.
But so I'm with you in that, in that, like, I just felt like I had to work so hard. So what happened there that you were translating, me needing to work hard into, maybe that you're not good enough, or what was going on there for you?
Yeah. And this is all like hindsight's 2020 now that I'm discovering all these new things. But I thought that if it didn't come naturally to me, that it meant that I wasn't good at, which is so classically a fixed mindset. And I really just thought that for so long, everyone was telling me that, oh, you're so smart and you're so this. And I never felt like that. It was always like, I'm not smart. I just work hard. I have to study all this stuff. And I think for me, that intrinsically meant that I wasn't smart, because in my own mind, smart meant you didn't have to work for it at all.
Right. So it was just you feeling like working hard, just, maybe there's too much resistance here. This isn't for me.
Yeah.
So obviously we fast forward a little bit, you're going through the, match process and all of that. When did it get even more difficult, like through residency? What was going on there?
Yeah, I think with every transition, it got more amplified. And as a resident, it was the same kind of thing where if a procedure didn't come very easily to me, or, as a resident, we had the tests that we had, like the in-service exams were called CREOG. They're probably called something different in psych.
Yep.
But that I'm not a great test taker. So it was those constant like comparisons about, my clinical judgment versus my ability to perform on testing, which there was always a mismatch there, I think, for me. So that always made me feel like, this is, what was I thinking doing this? And it probably got a little bit better my 4th year. But then I think ultimately it was because just how the nature of residency training right now, where you're never really left alone. I mean, there's always an attending there, or a chief resident if you're a junior level resident. So you never really truly feel that the buck stops here with me as a resident. At least I didn't. Right. So I think that I wasn't quite prepared for that as an attending, where it was really, this is how you're going to feel when you're the one making all the decisions.
Yeah. So obviously, there was someone you could kind of shift things over to. So did it come to a head at any point? Did you feel like, what am I doing here? Like, what was there an intense moment where you were like, what is going on here?
There was, but it wasn't until after I became an attending that it was kind of how I feel about it now. It was kind of like this simmering under the surface where I was, perhaps doing a lot of, I was drowning out those emotions with, bad habits like eating junk food and binge watching The Bachelor. And so for me, it really came to a head as an attending. And I think that's where I was Googling how to quit my job, essentially.
Okay. Okay. And so when did you discover, what was this moment where you're like, wait a second, I've had imposter syndrome? And of course we've kind of alluded to it, but when did you define that for yourself and how did you move forward from there?
What I eventually what happened is through this whole this self-discovery transition that I went through, which I was simultaneously trying to recover from having my second child and kind of learn some healthier habits at the same time, trying to figure out how to not be a doctor anymore, but pay back my student loans. And through that transition, I came across some podcasts that ultimately talked about things very similar to what you teach about, the very basic truth that your thoughts create your feelings. And that was something that, as simple as that sounds, I never knew. I mean, maybe I knew it deep down, but it never occurred to me oh, what I think is making it causes how I feel. But more importantly than that, I can decide to think whatever I want. And that moment was what changed everything. Because then I could make the connection of why I'm feeling like an imposter because of a thought that I'm having. Mm-hmm. And I can change that thought, which is ultimately what I did.
Yeah. Yeah. And that's really powerful. Like that moment of clarity. It's so funny. And I'm with you. I think I had a different moment for me, but it's funny when we realize in psychiatry, actually, one of my psychologists that I work with gave us this handout and it's called the poison parrot. And the reason it's called the poison parrot is if you think about a parrot constantly saying the same things over and over again, it doesn't really have a consciousness like the way that we do. It just keeps repeating things. But the poison parrot tells you everything that's wrong with you. It's constantly squawking and it's constantly repeating all of the negative things about you. You're not good enough. You're not good looking enough. You're not able to work hard enough. You're never going to be who you're not with the right person. You're not doing this. You're not doing that. And it's constantly squawking. Mm-hmm. And it's like, those are the automatic thoughts, but the way to, if you think about a literal parrot, what do? You cover the parrot, you ignore it. If it keeps squawking, you say, shut up, parrot, you put it in the corner and you realize that thing that's squawking at you, those are just automatic thoughts. And it's not a reflection of who you are or what you are. It's just, for better or worse, we have that judgmental thinking, and it's okay. And I think, so many people, and I love that we're talking about this. I just think so many people have this thing that's telling them constantly they're not good enough. But to be honest, it's just like, okay, so whatever, get away from me.
Right. And that's the thing that's so incredible to me is that when I realized that these are thoughts that everybody has, they're just thoughts that the brain has and are not my thoughts, which sounds really crazy, but that's when I could kind of remove myself from that and just say, I'm not even going to pay attention to that. Mm-hmm. But I think the sad thing is that so many people don't know to do that. And and they're not able to recognize they're having it, which I didn't. I probably didn't even hear that voice in my head. I just always felt like crap.
Right.
So realize that these thoughts are going on and that you don't have to believe them is so fundamental to your happiness and really what led to my dissatisfaction with my career. And I just think that everyone should know this stuff.
Yeah, absolutely. So what would you say, let's take a time machine. And let's say you are, you could even just talk to yourself, right? So let's say you're in college, you're going to transition to med school. What would you have told yourself? Like, what would you have, what message would you send?
To myself, transitioning from college to medical school, I would have said that I'm on this journey because it's the journey that I was meant for. It's called to me for a reason, and that I am meant to be learning every single day. And it's supposed to be challenging, and you're supposed to have to work hard, and you're going to go through some tremendous growth and come out a better person on the other side.
That's awesome. I love that. And would you say anything about like the imposter feelings? Would you say anything about those thoughts and those voices?
I think that fundamentally, I mean, I think it's important to name that, like, this is imposter syndrome. Almost everybody has it, but fundamentally, you get to decide the thoughts that you think about yourself, and you need to decide for yourself what's going to best serve you, because thinking that you're not good enough doesn't get you where you want to be in life. You could think that you're exactly where you should be today, and this experience happened so you can learn from it.
Mm-hmm.
And failure isn't the worst thing that could possibly happen. So I think it's really more about the recognition that you can take control of what you think every day and how much of an impact it can make on your life.
Yeah. And so I don't know if you have a strategy for this. This is actually something I do, and I wish I did it more often. I'll probably have to get back into the habit again. So there's something I used to do more frequently called priming. And it actually, one of my other mentors I work with, he does this basically, but there's a routine you can create in the morning and at nighttime to prime the mind, because the way there's different ways to look at the mind, but one of the ways that I think is important to think about is the mind is almost like the mind takes in, it's like a radio station, and it takes in the frequency of what we're kind of giving out and what we want. So if we think about it in that way, have you noticed that if you're in a really positive place in your life or things are going well, your thoughts tend to be more positive, right? And it's kind of like a chicken or egg situation. But also if you're in a depressed state, you tend to attract, or more negative things come in and you tend to notice the negative things about stuff. So priming is this way of using, basically at this point, scientifically proven, and also there's plenty of research in social sciences about this, is to use certain techniques to prime the mind so that you're more likely to have positive thoughts. So simple things like a gratitude practice in the morning, saying thank you to very basic things. Thank you for waking up. Thank you that I got to wake up this morning. Thank you that I have a bed. Thank you that I'm able to have an occupation. Thank you that I have the ability to have food on the table, and really just paying attention to, those really good things. And the other part of priming is also visualizing things that we would like to have in our life, or the way we would like to feel, or the actions we would like to take. And the reason I think that works so well is by almost planning or creating that vision in our heads. It doesn't allow for the negativity to come in, in that day. And I've found it for myself personally. It's really allowed me to stay positive, because once you get out of bed and you start doing stuff and whatever, and all the distractions come at you, you're going to be bombarded with stress, right? I'm just curious, do you have any personal strategies you use, or do you just say positive things to yourself? Like, what do you do?
Yeah, I have implemented a gratitude practice probably about a year ago now, where every morning, the first thing I do, I stopped looking at my phone and email and social media in the morning, because I just realized how that wasn't serving me at all. So I write down every morning, today, my intention for the day is today will be a great day. And then I'll write down, like you said, exactly that, very basic things I'm thankful for my health, that I get to work today, that my kids slept through the night, things that aren't huge. And that has made a tremendous shift in my life. Visualization, it's right up my alley. That's something that's was hugely impactful for me. Especially where it became like where I was most nervous and I was most worried about, like being on call, performing surgeries by myself, where I just felt like I was lacking that confidence, and being able to visualize the steps of me going through that surgery. I don't know if you're familiar with the studies. I found a few studies on PubMed about maybe a year ago now about visualization among surgical residents, where they showed them in an operating room how to do a cholecystectomy. And then they split them into two groups, and they said half these half the residents will do normal studying, like textbook studying, and half of the residents will do guided imagery where they're picturing themselves doing the surgery. And then they brought them back together. And I think they did some sort of like simulation, and they compared the two groups, and the group that did the visualization, so no additional textbook study, just pictured themselves doing the surgery from beginning to end, did better. Yeah. So it's really amazing. It's an amazing thing. So those two things have been influential. And then it's that constant kind of just having that metacognition where I'm listening to the thoughts that I'm having and consciously changing them.
Yeah, I think, with the whole visualization thing, that's again up my alley too. Cause in gymnastics, like, I had to do, I competed at the Division I level. I competed at the NCAA championships. So I was competing at a pretty high level, and we were doing some stuff that, and same thing with the surgery, honestly, when you're doing some stuff that can literally be life and death if you're not operating in the, proper sequence. But I'll be honest, when it came to pommel horse or rings or para bars or high bar, any of these events I was doing, I saw that routine in my mind 1,000 times, because when the pressure was on and my team was cheering for me and all of that stuff, it was like I had to perform. And as you know, I'm sure now that you've done your procedure so much, for example, delivering a child is probably like, it's like clockwork. You're not in your head. It's an automatic process. So I'm actually curious, again, I'm not an OBGYN by any means, but what was it for you? Obviously, you talk about imposter syndrome, but I'm assuming now you've gained some more confidence, right? What was it that allowed you to gain your confidence as a kind of more of a fresh attending?
Yeah, obviously there's nothing to be said for experience, right? The more that you do something, the more confident that you feel. But for me, it really, the thoughts that I was having were so detrimental to my ability to do my job. Like really thinking like, I don't really belong here. I'm not a good physician. I'm not a good surgeon. I'm not experienced enough. Made me feel how could you have confidence when you think those things? Yeah. Versus thinking things like, I learn something new every day, or I am a careful and skilled surgeon. These basic things that I can provide myself evidence for, the more that I do them, I can honestly say that probably the thoughts that I had in my head have trumped the experience and the ability to provide me with confidence and satisfaction 2-to-1. I mean, and it's that profound. Because I'm only in my 4th year as an attending, but when I was able to shift my thoughts about myself and being able to use tips like visualization and gratitude, I became a better physician. I became a more present doctor and mom, and I became a better surgeon, just because that confidence comes from within. Yeah. When you're visualizing yourself doing something, and athletes are really good at this, as you know, your brain doesn't know the difference between something that you have pictured in your mind and actually done. The tracks are the same. The neural pathways are the same. So when you're visualizing things, that's going to help you in the operating room or on the court or whatever. Yeah. It's going to make a huge difference in your life.
Yeah, no, I absolutely. And it's so funny to talk about this. I do a lot of this work, obviously, in psychiatry and my work in therapy, but core beliefs are such a powerful force. And when you believe, with imposter syndrome, you're basically believing that you're not good enough. So like when you got that letter that told you got in medical school, you're like, no, that can't be right, because the evidence said that you were good enough, right? They believed in you. And yet, your mind went to, I'm not good enough. That can't be right. I'm not good enough. There's no way I'm supposed to do this. This is too hard. I'm not good. It's that constant thing. And that's the one thing I would point out for anyone listening to this is you got to look at the evidence look at reality as it is. Look at the real evidence. I performed this cholecystectomy procedure correctly. I am good enough. I can do this. I delivered this child effectively. I am good enough. I can do this.
Mm-hmm.
I was able to prescribe the right medication. I am good enough. And I think, obviously I don't want to be unrealistically optimistic on the other end, right? Because optimism in itself can also land you into bad water.
Correct.
Overconfidence is also not, good, but you do want to balance, your one's negativity with what reality is.
Mm-hmm.
And I think that's very powerful. And I see those parallels a lot in the work that I do.
Mm-hmm. Yeah.
Were you going to say something? Sorry.
I was just going to say that for me, like I think most physicians and people in medical field can relate to needing like a stepwise process when it comes to doing this. So for me, it was, I put the steps as far as changing your thoughts into 3 steps. So the first step is just to recognize that you're having a thought that's making you feel like an imposter. The second is to review it. If it's true, like you said, provide actual evidence that cannot be argued to support that thought, which most of the time for negative beliefs or imposter syndrome, there is not much of anything at all. Mm-hmm. And then the third step would be replace, which is when you pick a thought that it feels true to you and replace that thought. And the important thing is, of course, you can't just go from, I think I'm the worst physician of all time to I'm the world's greatest physician. Like that's not going to feel true to you.
Right.
When I was struggling with imposter syndrome, had a lot to do with me being on call and feeling like something was going to happen that I didn't know how to handle. That was the recurring thought that I was having. And I was able to shift it to, I can handle anything that comes my way. And that was very easy for me to believe, because it didn't mean that I knew everything, but it did mean that I knew how to ask for help, that there were some emergencies that I had experience with, and that I knew, and that I had backup if necessary. So I think that's very important. Like you said, is you're not going to just all of a sudden become this like arrogant person who thinks you're the best, but there is a difference between not believing in yourself and feeling confident with where you're at, but also what you need to learn.
Yeah. Yeah. It's funny because, now I'm in my 3rd year residency, so I get to mentor like the interns and, the second years and stuff. And I get really scared. Honestly, I'm okay with, interns and the second years being really hard on themselves, not in like a ridiculously hard way. You want to encourage them. I actually get more concerned when I see the hyper optimist. Mm-hmm. That's what scares me the most. I won't go into details, but doc, I saw a patient with a blood pressure of 200 over 1 something. I guess it's okay, right? Like, I don't think we have to go and then I'm like, we need to sprint up there right now. That's not a good sign. Yeah. Just like the overall, like so much optimism to the point that they think nothing wrong is going to happen on their watch. And that's when, some bad stuff can happen.
Right. You get in trouble with that.
So yeah, I think the negativity or that kind of imposter syndrome also does serve a purpose. And actually read about this too. It is in some ways you are being realistic. Like if like when you do enter medical school, you don't know anything.
Right.
And right. when you're an intern, you don't know anything.
Yeah.
Well, you know some things, but you don't know, clinical practice. And so it is, I think it's important to balance what's real versus, where you actually are at. And maybe part of imposter syndrome also is just not being sure where you're at on that scale of competence, where you're on that scale of, are you truly competent enough to be confident? And sometimes we're not able to necessarily label what competency we've actually achieved, right? Like, I'm sure you can't be confident in doing a cesarean section after doing it 5 to 10 times.
Right.
So, I mean, how many C-sections do you have to successfully perform in order to truly say I've reached the competent level of some form of mastery? I don't know what that number is, but you know what I mean? You have to you have to also be realistic.
Absolutely. Yeah. And I think that's important because so much of confidence doesn't mean that you think you're amazing at everything. but it's a self-awareness of these are my strengths and these are my weaknesses. And this is what I know that I don't know, which is fundamental for physicians because it's impossible for us to know everything. And I think true, humble confidence, which is my favorite type of confidence that I have learned, is that you know your skills, you're comfortable with your skills, but more importantly is you know when to ask for help and you know what your weaknesses are. And I think that combination is the goal, at least for me.
Yeah, absolutely. And it reminds me of the, I think it's the Dunning-Kruger curve. Do you know what I'm talking about?
No.
It's so basically there's this curve. I see in your face. Yeah, you remember now. And it's that curve where if you don't know a lot about a subject, you are hyper confident. And then as you start to enter the world of a difficult subject such as medicine, you realize how absolutely little you know. Yeah. And then you become very meek and, obviously imposter syndrome and all that stuff. Mm-hmm. And then as you gain in skill, you reach a level where you know what you don't know, which is what we're talking about now. Yeah. And so you gain confidence in knowing you can ask for help. But that gap between, oh crap, I don't know anything, and knowing what I don't know is such a important phase of the training cycle. And I think the big part there, especially for early trainees, and I'm sure you're going to agree with this, is having the confidence to advocate for yourself and to advocate and say, I don't know, I don't know this. I think there's if you're really uncomfortable in yourself, you might not be confident enough to say to your superior, I actually don't know what's going on here. And you don't want to look like a fool.
Right. It's true. And I think that, when it comes to training in particular, the recognition that you're not supposed to know everything when you first start. And it really should be, it's a time of growth. And if you don't take those days to really make sure that you do understand things and find mentors who you feel comfortable with, then you're going to hurt on the back end when you're done with the residency, I think.
Mm-hmm. Yeah, absolutely. Absolutely. So I want to shift gears for a second because I know you are doing OBGYN, but you're also a mother. Mm-hmm. And I think that is obviously, again, I'm not a mom and I don't have kids. So I think that's another challenge that, I think it's another layer of challenge to be a female, to have kids in training. And I can't ask this enough from moms who are in medicine. What are the challenges? Like, what did you experience, and what are some of those challenges what skills have you needed to gain through that process?
Yeah, I mean, certainly it is a challenge, and I think the number one struggle for me has been the guilt, the mom guilt, and the recognition that there are some days that my patients are going to need me more than my family. And there's some days that my family is going to need me more. And so it's this kind of this imaginary thing of work-life balance that I don't know if it really exists, but it's coming to recognize that you have sometimes these two competing factors, and they're not always going to be complementary. They're going to be competing sometimes, and really feeling comfortable in your role in both overall. And you're going to certainly have days, I do often, that you feel like you failed as a mother. There are going to be days where you feel like you were distracted as a physician because your kids were homesick. So I think most importantly, it's putting your needs first as a parent in general. It's more, for physicians also, of course, but really when you're a parent and a physician, you need to put your own needs first. And that means healthy habits, exercise, stress relief. Those things matter, because if you're putting your patients and your kids and your partner ahead of you, then you're floundering, and you can't sustain a life like that.
Yeah. Yeah. So what would you say to, a woman who wants to start a family in residency or early attending life? And, for you, OBGYN is, especially residency, I can say this for a fact, it's probably one of the hardest residencies just because of the ridiculous shift work and, L&D and all the stuff that OBGYN has to do. So what do you say to someone who wants to have kids, but also be a physician, whether it's in residency or attending?
I say that you should have kids and don't delay starting or continuing your family based on your career. I feel very strongly about that. Not that it's never going to be easy. It's never going to be an easy thing to do, but it's never a good thing to delay your family for your career because that'll lead to resentment. And secondly is really establishing what your goals are as a woman or a physician, what your goals are as a mom and what your goals are in life in general. And I think once you can establish what your goals are, then it's so much easier to carve out the job and the career that you want. And I think so often we're telling women that they need to be a full-time physician and a full-time mom and do all the baking and do all these things. It's so completely unrealistic. And I think what ultimately matters is that you need to just ask yourself, what do you want to be doing in 20 years from now? And this goes for any medical student, resident, whatever. And from that viewpoint, from that vantage point of the future, then you can really say, like, what can I sustain today? Mm-hmm. And that's a very important question, especially in OBGYN, where there are some jobs that you're on call every third night. But that doesn't have to be what your life is like. And if you want to be a mom and be present for your family, whatever that means for you, it's okay to say that. And I think that we need more people telling women that you can do both.
I love that. And I've had the privilege to speak to quite a few other female physicians and moms, and I've heard the same responses. They would not stop what they did for anything, and it's been an interesting challenge. But they've grown a lot through that process, and they've enjoyed it. So I love that response. Now, I think we're going to come to a close for the conversation for today, but something I ask everyone is, was there something you felt compelled to discuss that you're passionate about, that you want to let our listeners know today about who you are, what you do, and something you'd like to talk about?
Yeah, I think we touched on a lot of the things that I'm passionate about today. One thing I really will tell people is, honestly, if you feel like there's more that I can help you with, then don't hesitate to reach out, because I'd love to talk to anyone, really. And I'm probably most easy to reach on Instagram at Kristin Yates DO. And I do have I guess I would call it a masterclass. It's like a little thing that talks in more detail about how I specifically got over imposter syndrome. That's available. And that's at my website at KristinYatesDO.com. But a lot of the stuff I'm passionate about is exactly the stuff we talked about today, and that there are mentors out there for young physicians and residents who love their job, and to really work hard to find those people like you who are out there, because we need physicians to stay in medicine.
100%. So the best way for us to reach you is at Kristin Yates DO, and that's on Instagram, and also KristinYatesDO.com, correct?
Yes, that's correct.
Amazing. So I really enjoyed that chat. I think it's just so important, and I think this is absolutely critical for any individual going through a transition, because the whole imposter syndrome, if I could kind of wrap this up, I believe, and I know you agree, is a transition point when you're going from one level of competency into a new level of responsibility that requires a new level of competency. And we have to be able to kind of understand that spectrum. And I thought we actually did a great job kind of going through those steps. So I really appreciate you and your time.
Yeah, thank you so much. It was a great conversation.
All right, guys, that's the episode for today. I hope you enjoyed that conversation with Dr. Kristin Yates. And if you felt like that was a great episode and you want to share it with a friend that might be impacted, please do. And also, please leave a 5-star review on iTunes. It's one of the best ways to support us. And I hope that you come back on, subscribe to The Happy Doc, and I'll see you on the next episode. Take care.